Hello, everyone, and thanks for joining in today to discuss the future of ABA, neurodiversity, empowerment, and belonging, shifting from compliance to compassion in autism intervention. My name is Dr. Ashley Knuckle, and I'm excited to discuss this important topic with you today. My journey into working with children with autism first began in 2013 during my time as a volunteer at the Autism Awareness Care and Training Center in Accra, Ghana. This was the first center established for children with autism in West Africa over 27 years ago. It was established by Auntie Serwa Quaynor, whose passion and mentorship inspired me to dedicate my life to this work. Today, I'm the founder and clinical director of Africare ABA, based here in Nairobi, Kenya. Our mission is to expand access to ethical, evidence-based, and culturally responsive ABA therapy services for children and families across East Africa. I also identify as neurodivergent. I have ADHD. And that part of my identity has shaped not only how I think and learn, but how I show up in this work. It's why I care so deeply about neurodiversity affirming ABA, care that uplifts dignity, celebrates differences, and centers the voices of those that we serve. I'm excited to explore with you today how our science can grow into a practice of inclusion, partnership, and possibility. So before we dive in, let's take a quick look at our learning objectives for today. We'll begin by exploring the principles of neurodiversity and what it means to practice neuroaffirming ABA, centering respect, autonomy, and lived experience. We'll also identify outdated and potentially harmful ABA practices and reflect on how to move away from them. Next, we'll shift from functioning labels to a more nuanced, multidimensional understanding of autism. And finally, we'll rethink how we define success, focusing less on compliance and more on quality of life and independence. These points will shape our conversation as we work towards more ethical, affirming, and effective ABA. Okay, let's start with something really foundational, understanding neurodiversity. So neurodiversity basically means that differences in how brains work are natural and valuable, not broken, not something that needs to be fixed or cured. It's like biodiversity in nature. You wouldn't look at a cactus and say, oh no, why aren't you a palm tree, right? Different doesn't mean bad. It means needed. It means beautiful. Now, autism, and I really want to emphasize this, is not a disease or a tragedy. It's just a different way of experiencing the world. Sensory input might feel bigger. Social communication might look different. Emotional regulation might need different supports, but different is not less. When we celebrate neurodiversity, when we actively create spaces that work for all kinds of brains, we build stronger, more inclusive communities, not just for autistic individuals, but for everyone. Because a world that works for neurodivergent people actually works better for all of us. All right, let's keep going. So now that we know that brains are supposed to be different, let's talk about what it actually means to affirm that. The neuroaffirming movement basically says autistic people don't need to be changed to fit into this world. The world needs to change to fit them. Historically, a lot of interventions, including some parts of ABA, have been about making autistic kids act normal, or what we're taught in grad school, indistinguishable from their peers. Instead, neuroaffirming practice is about supporting people to be their authentic selves. It's about honoring stimming, honoring different communication styles, even if that means scripts, AAC devices, or no speech at all. It's about prioritizing autonomy, dignity, and joy, not just compliance. If your intervention only works when the person hides who they are, then it's not a good intervention. Neuroaffirming ABA shifts the goal from fixing behaviors to building meaningful, empowered lives on the individual's terms, not ours. And honestly, it's not just more ethical, it's more effective. Really, it's very simple. When people feel safe, seen, and supported, they thrive. Okay, so if you ask most people to picture autism, this right here is probably what they see. A straight line from low functioning to high functioning. Or maybe they think in terms of level 1, 2, and 3, or labels like mild, moderate, severe. And here's the thing, this model is super outdated, and honestly, it's harmful too. Functioning labels like high functioning or low functioning are very misleading because they don't actually tell you anything about a person's real life experience or what supports they need. They just tell you how comfortable a non-autistic person feels around them. A person might be considered high functioning because they can talk, but still struggle massively with sensory overload. Or someone might be labeled low functioning because they're non-speaking, but then they could have deep, powerful thoughts and emotions they just can't express vocal verbally. Labels flatten people. They erase complexity, and they can deny people access to supports or autonomy, depending which side of the line someone decides you're on. So today, we're tossing this model out the window because autism is not a straight line, and human beings are way too rich, too dynamic, too beautifully complex for a single label to ever define them. All right, so if autism isn't a straight line, what does it actually look like? It looks more like this. The autism spectrum is multidimensional, kind of like a color wheel. Each slice represents different areas: sensory processing, communication, executive functioning, motor skills, emotional regulation, you name it. And the intensity or strength in each area can vary widely from person to person. Someone might have huge sensory sensitivities, but be really strong socially. Or someone might need a lot of support with communication, but be incredibly independent with problem solving. It's dynamic. It's beautiful. It's human. This is why functioning labels don't work, because they're way too one-dimensional for something this complex. Instead, we focus on individual support needs, like this person needs help navigating transitions, or this person thrives best with visual schedules. We focus on contextual strengths, like this person is amazing at building deep connections, or this person sees patterns that no one else can see. And most importantly, we honor self-expression, however that shows up for the individual, because the goal isn't to change the colors to all match. It's to let each person's true colors shine. All right, now that we've ditched the old model and embraced the wheel, let's talk about what we can actually do differently in our practice. Historically, and I say this with a lot of care, ABA has focused heavily on teaching kids to look typical, not to be happy, not to be confident, not to be themselves, just look normal. A lot of early programs focused on things like making eye contact, even if it was painful, sitting still for long periods of time, even if their bodies needed to move, and imitation, copying behaviors just to fit into a neurotypical mold. There was also a lot of suppression of natural behaviors like stimming, hand flapping, rocking, scripting. All these things that can actually be incredibly self-regulating for autistic people were seen as problems to eliminate. Being quiet, following directions, blending in, even if it meant sacrificing emotional well-being or autonomy. When we zoom out and look at it like this, it's pretty heavy, right? We have to own that history, and we have to actively do better, because our goal is not to create little robots who blend in. Our goal is to build people up, to help them live authentic, joyful lives on their own terms. We're not here to shame the past. We're here to build something better for the future. Now that we've looked at the past, let's focus on where we're headed. Contemporary neurodiversity affirming ABA looks very, very different from traditional compliance-based models. First, it supports autonomy and respects communication differences. That means no forcing eye contact, no shutting down stimming, no assuming speech is the only valid form of communication. We honor whatever communication the individual naturally uses: gestures, AAC, scripts, because it's all communication. Second, goals are chosen with families and clients, not for them. Gone are the days of therapists walking into a house with a clipboard and a preset checklist. We collaborate, we listen, we co-create goals that are actually meaningful to the person's real life, not just to make adults feel comfortable. And finally, and this part is really important, we're building skills for a joyful, independent, authentic life, not for passing as neurotypical, not for blending in, but for thriving on the individual's own terms. Because success isn't about looking normal. Success is about feeling empowered, valued, and connected exactly as you are. This right here is the future of ethical, effective ABA. Let's take a moment to walk through this table. It captures a core shift in how we think about ABA from a traditional compliance-focused model to a contemporary neurodiversity affirming approach. First, traditional ABA emphasized obedience and control, getting children to comply often without considering whether their goals were meaningful to them. Contemporary ABA shifts that focus to autonomy and self-advocacy, helping children find and use their voice. In social skills training, the old model aimed to teach neurotypical behavior. Think eye contact, scripted greetings, appropriate small talk. Today, we focus on respectful communication and choice, building relationships that work for both autistic and non-autistic people. With stimming, the difference is stark. It used to be discouraged or redirected, but we now understand that it's a valid form of self-regulation, something to support, not suppress, unless it's harmful. On session structure, traditional ABA favored discrete trial training, rigid and adult-directed. Contemporary ABA leans into flexible, child-led play in natural settings, where learning is meaningful and joyful. And finally, how we measure success. In the past, it was about making a child indistinguishable from their peers. But now we ask, are they safe? Are they heard? Are they thriving? Success today means autonomy, dignity, and well-being, not just compliance or conformity. This isn't about rejecting ABA, it's about evolving it. We can still be evidence-based, but also ethical, affirming, and centered on what truly matters to the people that we serve. Now that we've seen the big picture shift, let's zoom in and get really clear about some specific practices that we know today are harmful. Historically, things like forcing eye contact, forcing physical touch, or forcing kids to sit still were considered basic parts of good therapy. But we now know that's not best practice. In fact, forcing these things can cause real harm. Imagine being told that you must stare into someone's eyes when your brain is literally wired for that to feel overwhelming or even painful. Or being told to keep your hands still when rocking or fidgeting is how your nervous system calms itself down. When we suppress harmless stimming, things like hand flapping, scripting, rocking, we aren't just removing a behavior. We might be harming a person's ability to self-regulate and feel safe in their own bodies. So what's the goal instead? The goal is to make therapy a safe, affirming space, a place where kids and adults can be themselves, explore who they are, and build skills without fear of punishment or judgment. Because when someone feels safe, real learning can happen. And when someone feels celebrated, real growth is possible. A joyful life is the ultimate goal. Not quiet hands, not eye contact, not fitting in. So how do we build an ABA practice that's ethical, affirming, and trauma-informed? First, emotional safety has to come first, always. Before we even think about skill acquisition or behavior change, we have to make sure that the individual feels safe. Because when people feel unsafe, their brains literally shift into survival mode, and no meaningful learning happens from a place of fear. Second, we always have to offer choices, even and especially if the child is non-speaking. Every person deserves the chance to say yes or no, to express preference, comfort, and consent. That might mean presenting 2 activities with visuals, offering a break, or reading body language when someone is pulling away. Assent isn't just verbal. It's any way someone tells you I'm okay or I'm not okay. And it's our responsibility to listen. And third, and this one changes everything, we recognize behavior as communication, not misbehavior. A meltdown isn't bad behavior. A meltdown is communication. It might be saying, this environment is too much for me, or I need help and I don't know how to ask for it. When we shift from asking, how do I stop this behavior, to what is this behavior telling me? We move from control to compassion, from punishment to partnership. And honestly, that's how real trust is built. Because people remember how you made them feel, not how many stickers or tokens you gave them. So now let's talk about something that should always be at the center of ABA, families as empowered partners. Parents know their children best. not the therapist, not the program supervisor, the family. You, as the parent or caregiver, are the expert in your child's life, your culture, your traditions, your values, and it's our job as professionals to respect that expertise, not to bulldoze it. Therapists should be guides and collaborators, not commanders. We're not here to run the show. We're here to offer tools, share knowledge, and build strategies together. That's why in neuroaffirming practice, we co-create goals. We sit down and ask, what are your hopes, your dreams? What matters most to you? Because real goals, meaningful goals, aren't just skills checked off on a clipboard. They reflect the family's vision for a joyful, connected, independent future. When families feel empowered, the kids thrive. When families are valued as true partners, we build something that actually lasts, far beyond therapy sessions or treatment plans. Let's be honest, even in individualized ABA programs, cultural context is often overlooked. We may tailor goals to the child, but not always to the family's values or way of life. But culture shapes everything. How we teach, how we parent, how we define success. Ignoring that doesn't just limit our impact, it risks disrespecting the very families that we say that we're here to support. In African contexts and across the globe, families bring rich traditions, spiritual values, unique social roles. If our therapy goals don't reflect those realities, we're not empowering families, we're imposing on them. Cultural humility isn't optional, it's ethical practice. If we're not willing to listen, learn, and adapt, then we're not truly practicing behavior analysis. So yes, we need evidence-based strategies, but they have to make sense for the people that we serve. Otherwise, we're just doing therapy to families, not with them. All right, so now I want us to really challenge how we define success. Success is not just a child learning to talk or sitting still or making eye contact on command. These things might be parts of development for some kids, but they are not the full story, and they should never be the only story. True success means a child is happy, a child feels safe, a child is able to make their own choices about what they want, what they like, who they trust, how they want to move through the world. And guess what? Emotional growth is just as important as academic growth. Friendships are just as important and meaningful as math skills. Self-advocacy, being able to say yes, no, I need a break, or I want something different, that's real success. Because a person's worth is never measured by how close they can appear to neurotypical norms. Their worth is already there. Our job is just to clear the way for it to shine. So when you think about setting goals, let's move beyond milestones. Let's build futures full of connection, joy, and choice. So if we're moving beyond milestones, how do we actually measure success in a way that honors the whole person? One important tool we use is social validity. And that basically means asking, does this feel right to the family and child? Not just, did we complete a program checklist? Or did they master a target? But is this goal meaningful to their real life? Does it reflect their hopes, their values, their happiness? Because real success, real progress should include emotional well-being, belonging, and joy, not just skill acquisition. And here's the heart of it all. The child's voice must guide us. Even if they communicate through gestures, AAC devices, pictures, scripting, whatever the mode is, their communication matters. Their preferences matter. Their boundaries matter. If we ever find ourselves moving forward on a goal that the child clearly resists or is distressed by, that's our cue to stop and to listen. Because the real data, the most important data, isn't always in the spreadsheet. It's in the connection. It's in the consent. It's in the smiles, the calmness, the moments of yes. That's how we know we're really doing it right. All right, let's wrap up. So to wrap up everything we've explored together today, first, neurodiversity is natural. It's not a mistake to fix. It's a beautiful part of humanity to celebrate. Second, traditional ABA must evolve. We have a responsibility to center emotional safety and autonomy and dignity. not just compliance. Third, culturally responsive neuroaffirming ABA is not optional. It's essential. When we respect culture, collaborate with families, and celebrate individuality, we build interventions that actually work because they actually matter. Fourth, success isn't a checklist. It's not eye contact, quiet hands, or blending in. Success is belonging. It's joy. It's the freedom to self-advocate and to thrive. And finally, our true goal is simple. Create safe, empowering, joyful spaces where every autistic individual feels seen, heard, valued, and free to be exactly who they are. Because that's what real change looks like. And together, we can build it. At the heart of everything we've talked about today is this simple truth. True inclusion isn't about changing people to fit a system. It's about changing the system to fit the people we love. Every child, every individual deserves to be seen, heard, and celebrated exactly as they are.